This video is intended for education and training of eye surgeon. Viewer discretion is advised, not recommended for children. Hello friends, I am Dr. Saurabh Patwardhan from Nandadeep Eye Hospital and Phaco Training Center. In this video, I will be dealing with a case of extremely eccentric pupil with cataract. So this was the presentation. Patient is a 60-year-old female, anesthetist by profession. She had history of childhood trauma and since then her vision is subnormal around 20/60, and now there is further deterioration of the vision because of formation of cataract. And as you can see here, the pupil is strikingly eccentric as it is dragged into the previous injured sclera. So there are a few issues to deal with here. The first of all, biometry was not possible in undilated pupil as the optical center was covered with iris, so we did dilated biometry and it showed astigmatism in the cornea, so we needed toric IOL to correct the astigmatism. And of course the most striking thing here was the extremely eccentric pupil. So let's start thinking. I'll be using iris hooks to do phacoemulsification with toric IOL, and of course I have to do pupilloplasty. Now how will I bring the pupil to the center? One option is to cut the pupil on one side with scissors or use vitrectomy probe, or something which can spare the sphincters, because either with vitrectomy probe or by scissors the sphincters are going to be damaged and we may be having a dilated pupil in the postoperative period. So the first part was to mark the cornea for the toric IOL placement, and then I'll be using two iris hooks to retract the iris, and then after retracting the iris, the pupil is dilated enough for doing phacoemulsification. Phacoemulsification was done using stop and chop method. I am taking extra precautions here to spare the posterior capsule because I don't want to complicate things further. And I am implanting toric IOL and trying to place it on the axis as far as possible before removing the OVD from the bag. But I will be injecting 1.8% sodium hyaluronate in the anterior chamber at the end so that I can do the pupilloplasty procedure. First I tried to release this iris from the incarcerated site. It was not possible, and you can see this is the center, optical center of the eye, which is covered by the iris even in partially dilated state. So the next step is to make this pupil more central. So I'm going to use a unipolar diathermy with linear energy, and the heat produced here is going to cause shrinkage of the collagen of these radial fibers, and it is going to retract this iris from the center. So you can watch here how I am carefully using unipolar diathermy, which we commonly use for retinal surgeries. I have seen this technique being used by Dr. Sergio Canabrava, and now you can see the optical center is uncovered, the iris is dragged on one side, and I have marked the optical center now with that blue dot, and you can see that I am further using the diathermy to shrink the iris away from the center till I feel it is adequate enough. Once the diathermy is done, after that I'll be doing single pass 4-throw pupilloplasty here using 9-0 Prolene and using the standard railroading technique, and the loop is taken out using 25 gauge forceps, and then I pass 4 throws of the cut end of the suture through this loop, followed by pulling the two ends of the thread using McPherson to reduce the iris defect on one side. I'll be adding one more suture in the periphery to cover the gap, and now I am going to remove the OVD from the anterior chamber, and now I am trying to check the position of the toric IOL, just dragging the iris on one side and checking the final position of the IOL. I am well satisfied at the end with the outcome, and this is immediately post-operative next day. You can see the pupil is well centered, and this is after 1 month, and pupil is very well centered. Pupil is of adequate size, not unnecessarily dilated. There is no iris atrophy or pigment dispersion. The great thing is patient achieved uncorrected visual acuity of 20/20. From the point where we started and what we achieved in this particular case was really good and very satisfying. For more such videos, do subscribe to my YouTube channel and do visit our website phacotraining.org.in. Thank you.